diabetes with cinnamon or meditation.
You're joking.
What?
You're
No
joking.
way.
Let me teach you a thing or two. Yo, 8 Mile.
What's up?
Let's kick it. Alright, stop. Pick up your pencil and listen. Miss Pumpkin Patch is here with a lesson teaching you about diabetes, type 1 and type 2, so you better listen carefully.
What have I learned?
I don't know. Put down the phone and let's go. To the extreme, I know my stuff like a book. Listen to me and I'll get you off the hook. Type 1, it's autoimmune. It kills my beta cells like a poisonous mushroom, deadly without insulin. That's why I wear a cover, take shots for the win. Love it or leave it, gotta do it every day. Better check myself, blood sugars don't play. If I knew the problem, yo, I'd solve it. Type 1 ain't got no cure, so I can't resolve it. Now that you know about type 1, with my book in hand, I'm gonna teach you about the common one. Get to the point, no faking. Hold on a sec, I think that I'm shaking. Type 2 is more about your lifestyle. It matters what's in your genetic file. Some high carbs, you better forget it. If you got type 2, then you gotta get rid of it. Resistance of your insulin. Without good absorption, you ain't gonna win. The pills are on standby, ready to help the highs. Gotta hold off on the extra fries, keep on pursuing to the next block. Gotta work out and exercise a lot. You won't be dead, yo, if you continue to stay healthy and check your sugar. It gets crazy when your blood sugar is high. That's why you gotta try to keep it right. 200, that's considered high. Thirsty, gotta pee, an apple gross inside. 70, that's considered low. I'm shaky and sweaty and confused. I know alarms rang out like a bell. I need sugar, I'm sure you can tell. Falling, blood sugar's real fast. Help me out, dude. I need sugar stat. Smarties, chocolate milk, whatever sugar's fast. That's how you treat a diabetic who's low like that. PTA on scene, you know what that means. They treat a lot of patients with diabetes. We know the problem and we solve it. Knowing the symptoms help our patients resolve it. Diabetes a little bit better now?
Yeah, I think so.
Alright, well, I'm going to give you this book, 24 hours to read it. What? Your test is tomorrow. Get going. Go.
Done. Go.
Alright, what is diabetes?
A group of conditions that are characterized by a rise in blood glucose levels.
What are the differences between type 1 and type 2 diabetes?
Type 1 is not preventable ever. Type 2 can often be prevented. Type 1 is caused by an autoimmune destruction of insulin-producing beta cells in the pancreas. Type 2 is caused by insulin resistance. Type 1 often affects 5% of the diabetic population. Type 1 is most common in children, and type 2 is most common in adults ages 40 and up.
Stop it. How is diabetes diagnosed?
Fasting blood sugar test that is greater than 126 or a random blood sugar greater than 200. Type 1 and type 2 are separated by low C-peptide level and presence of auto-antibodies in type 1.
What are some therapies and medications used in diabetes?
Well, insulin can be given through injection or through an insulin pump, such as these here, or oral tablets such as these, diet and exercise.
Insulin is a hormone produced by the beta cells of the pancreas. Insulin is the hormone that turns glucose into energy so that our cells can function. Without insulin, our bodies will die on a cellular level due to lack of energy. All patients with type 1 diabetes and some patients with type 2 diabetes require insulin injections or insulin pump therapy to prevent diabetic ketoacidosis. Diabetic ketoacidosis occurs as a complication in relation to lack of insulin. It occurs when the body's cells do not have the energy they need to function, and the body starts pulling from fat and protein, which turns into acid in the blood. This could be a deadly complication of diabetes. Some people with type 2 diabetes may require metformin or sulfonylureas, which are types of oral medications used in type 2 diabetes. These medications help the body to better use the insulin that it does produce for people that suffer from insulin resistance. These medications can cause hypoglycemia, so it is important to monitor these patients as well as your patients who take insulin. What are the symptoms of hypoglycemia?
Blood sugar less than 70, shakiness, sweating, dizziness, confusion, and fainting.
What are the symptoms of hyperglycemia?
Blood sugar greater than 200, thirst, frequent urination, blurry vision, stomach pain, as well as weight loss.
How do you treat a patient presenting with hypoglycemia?
With fast-acting carbohydrates such as chocolate milk or Smarties.
How do you treat a patient presenting with hyperglycemia?
You should go ahead and consult your doctor or nursing because as PTAs, we cannot administer insulin.
Some complications of poorly managed diabetes and chronic hyperglycemia include diabetic retinopathy, diabetic neuropathy, stroke, cardiovascular disease, and kidney disease. One of the most common complications we will see with diabetics in the clinic for physical therapy is peripheral neuropathy. Many of these patients will have numbness and tingling and pain in their feet. This can cause wounds and it can cause possibility for amputations. Mr. Smith here, he has some peripheral neuropathy, and so we're going to test his sensory abilities in his feet to see if he can feel what I'm doing. So close your eyes. Do you feel that?
No.
Anything?
Yeah.
No? What about this foot?
Yeah.
Don't feel it? Nothing?
Nothing.
All right, you can open your eyes. So, you've had some wounds on the bottom of your feet, haven't you?
Have I?
You have. Remember we did some wound care?
Oh, yeah, that's right.
Yeah, so we want to make sure we prevent any worse wounds so that we can keep these feet. So, have you been looking at the bottom of your feet every day?
Oh, no, I can't even get my feet up here.
Well, one thing we can tell our patients to do is to get a mirror, and they can look at the bottom of their feet in a mirror to see if they've got any new sores. Now, have you been walking around the house barefoot?
Oh, yeah.
Yeah, well, we probably need to go ahead and wear some good shoes around the house so that we don't step on anything, because you might not be able to feel if you step on a tack or something, okay?
Okay.
All right.
Hello?
Mr. Smith, I'm here for your home therapy today. What you doing?
I'm about to take a bath.
Did you check the temperature of that water?
Nope.
Well, remember, let's go ahead and come out of there so we don't burn our feet. Remember, you got to check the temperature of that with your elbow or with a thermometer. Okay?
Okay. In patients with neuropathy, we may be limited in modalities we can perform. Things such as hot and cold packs and e-stim may be contraindicated if used on the feet.
It is important to check the eval notes or consult with the PT before performing modalities on a diabetic patient's feet. In patients who use an insulin pump, like the ones pictured, it may be contraindicated to use certain modalities such as e-stim and heat. The patient will need to check with their diabetes doctor, their endocrinologist, or the insulin pump manufacturer to ensure that it is safe for them to receive modalities before they are performed.
Though diabetes is the most common endocrine pathology we will see in the clinic, we will most likely run into others as well. Some common endocrine disorders include hyperpituitarism, hyper and hypothyroidism, Cushing's syndrome, and Addison's disease. Are you still videoing?
Yeah, and we just cut out the mess ups.
Oh, so she's
And use them as bloopers. Ah, I knew it was coming. I lost my mouth. I said, whatever. We're gonna restart the song.
Like she is videoing?
Yeah.
Right now?
Yeah.
Wow.
And next. Try again.
Sorry.
Diabetes, type 1 and type 2, so you better listen carefully.
Oh my god.
You were just looking at me, and I was like,
I think.
no, that was me. I was supposed to say, yo, right? Oh my lord. Okay, if you pay attention to the screen on this, it says ice, ice.
Okay.
And you say, the 8 Mile.
Let's kick it.
Let's kick it.
Oh my god. She's gonna need a tripod.
Yeah, we can't talk during the music. Oh, that part. Every time. Every time.
What part?
Love it or leave it. Gotta do it every day. That part
Love
gets
it or
me.
leave it.
I got the first part so good. Woo!
I was like looking at my thing, just like
You were, and I knew
pretending.
you were gonna miss it. Rang out like a bell. Now, but we're getting there, like really. I'm like throwing stuff, having to focus on the words and throwing all this stuff around. Okay, here we go.
Oh god.
And
Hold up. When you say Amon, you think I should be like, what's up? Of conditions that are characterized.
I knew it was coming.
A group of character.
A group of characters. What is diabetes?
A group of conditions that are characterized and.
This is gonna take longer than the song. Are you? Oh my gosh. Do you want to
Dude, I want to redo that. That was just awful. Because I was trying to read that word. I can do it.
Let's restart with the question.
Okay, go.
What are some therapies and medical home? I got a mouthful. I gotta stop eating those things. My blood sugar's gonna be. God. Administer it. I don't know what it is.
Insulin.
So just say administer medication because there's other medications.
Okay,
besides it.
medication.